We are in the city of Bunia in the province of Ituri. Behind me you have the Ebola treatment center of CME, Centre Médical Évangélique, one of the centers which are receiving a person who people who are suffering from this disease of Ebola. Until now, the situation is still difficult because there is a number of people which are still getting inside, and people are trying their best to survive with this situation. Another thing is that with the capacity of building laboratories, because now the laboratories, there are so many people who are now and continue to be in need of some tests, but they can't access to it, including areas like Miania, like Nizi, like the health zone of Nyakunde, where the need still continue, even if in Bunia the situation is still stable with the National Biologic Institute, which is now established here in this hospital and in others area where they have the capacity. Another problem is the access on beds, because until now the capacity is 500 beds for people who are suspicious and confirmed case in this province of Ituri, and the number is very less, and it still continue to high and to add other bed to make sure that other people will have the same security, the same health assistance. Ebola treatment center is also one of other needs in so many areas. Last time we were in the area of Nizi, where people are in need of an Ebola treatment center because there are so many cases, but until now it's not operational yet, and this is making population to suffer and contamination to continue in communities. On the area of community, you have to know that until now there are so many people who are not believing on the existence of this disease of Ebola until now. So many members of the community are not believing on the existence of this, and there are so many people who are thinking about which and or other things which are making this situation. There are also other problems. There are also other problems like founding of local NGOs and local community organizers which could educating people, but which until now doesn't have any money and any way to get money and to get support from international NGO and international system to get access. And you have NGOs which international NGOs which are working on stabilizing the disease, but it's only members of the community who could stop the spread of this Budibudio outbreak, because they know people and they know how to speak to them. This is one of the biggest challenge here in Ituri. There is some announcement. The Ministry of Health here in Democratic Republic of the Congo, Roger Nkamba, who said that health in any case will be free for everybody, but until now it's not in fact and on the ground implemented yet. Another thing is about paying people who are working, volunteers who are working on the response and on stopping this outbreak. Until now we are at 53 days, and until now they are not paid yet. They are still waiting for their money, and they are organizing some strike to try to make the situation more known by media and by other actors, to make sure that they will be paid their money and they will get what they really need. Population is affected on the way that the Ebola is continuing to grow in the community, and there are cases who are coming. Until now, according to the government, there is now more than 600 people who are in Ebola treatment center like this one behind me, and there is other person, there is more than 500 person who died from this disease, but the number could be more because there are so many areas where laboratory are not working, and it's impossible and difficult to confirm if those persons died from the Ebola disease or not, and it only confirmed cases which are putting inside the data the government is publishing. And another thing is that until now the cases of confirmed Ebola people, it's now reached more than 1,050 cases in the province of Ituri, of North Kivu and South Kivu, here in the east of Democratic Republic of the Congo.